See all sorts of technology flying around here. Well, lights have finally descended.
So are people on the phone going to be interrupting? The mics will pick up the phone?
Yeah, but not really. There's nothing I can do about the mic. I looked for a way to get the phones into the system.
If they were going to be participating.
Hi, I'm Tom.
That's why they're principally. That's why I told them to really use audio from the.
Okay.
2003. Here, launching in South Africa. And of course, you were then working with Oprah in the capacities.
Okay.
Well,
I'm hearing
have you really? And what kinds of things are you going to work on? Is it similar in any way, shape, or form to the stuff you're doing? In my mind, I say that I'm confusing this conversation with the long-range phone conversation with you. The island name, the Unitarian Universalists. Is that it? Was that it?
I still go.
You do? Okay, because that would be really soon. Like if like not the next couple of weeks, if memory serves. Okay.
It's the 3rd of July.
Okay. All right. Wow. Wow. That's no, because I just remember your description just sounded fabulous. I mean, it sounds like just amazing.
I have a college-age daughter who's working out there this summer. Really exciting about it.
So my college-bound daughter is working on not just her attending camp, so it doesn't have much spiritual stuff going on. But still, it's nice to be for some person trying to make her
Seems like a fun name, but that guy's actually.
I mean, as I watch my kids and just hoping
So
that
people would think that that's possible.
Because they have no sense of humor.
that's really cool. The same. So my husband's here for 2 years, helping to set up the operations and stuff. So it's up and running, and it's probably this is part of the whole network. And as you may know, at NBC.
Yeah, funniest part of visiting Gene.
Oh, okay. Well, I think I well, perhaps
was like,
it's not lost that focus, so I would expect her to
like when she went on stuff, we went down to the lake on the pass.
I mean, it was interesting, living in Massachusetts.
We are steep. She has brakes, she's flying it down when she's coming back up.
Was she using a scooter?
She was. Like took a walk around the whole neighborhood. She was fine. Except, man, wow, she was done.
Let's have a conversation.
She needed the elevator right away.
Anyways, my focus is in so working on that time to try to capitalize things in the investment program.
Well, isn't this because the blood's not getting through?
There's something wrong if you can't comfortably. That lady is totally fine. She didn't the elevator foot when she was sitting in her
Yeah,
house.
she said this wasn't as bad as she.
Right, but what I'm saying is if there's a flow issue that's causing throbbing pain and pulling and like blood rushing or fleeing her foot, then something weird going on with the way that the blood vessels are repairing down the wound, right?
Well, I just think that until the wound heals, the cast kind of
System that's out of
compresses everything.
yeah, kind of has like a tourniquet. So when she moves it up from the scooter, it doesn't flow through it where it's
Just from the
supposed
regular
to.
sort of less encumbered, more encumbered position.
But when she went to the doctor,
Saw them last week, so she goes again in 2 weeks.
Meeting here and now a little bit. But if they were actually investing in character, this is
So is she doing okay for food and everything? I called her on Friday.
That's coming with bringing.
Oh, not Friday, Thursday. Oh,
How are you? It's good to see you.
There's minus 100 plus 40.
But yeah, you know, she had someone bringing her food, and then, you know, the house seemed consciously, you know, she's all these adaptations. She's moved all of her everything downstairs, right? So she's got like some downstairs. And I asked her about the TV. You would Sasha have actually. She's a big TV downstairs, and I told her what maybe we could move some TV upstairs next time it comes. So she's got a cable connection in the corner. I think she's now. I feel bad. Like, there's all the shit I could do to get my ass there. We actually went, and I texted her at like 9. I said, we're going to breakfast in my plan. So, can we come by in an hour? Can we come by in an hour? And she said, yeah, I'll leave the whole hour. I know. The feet in her shoes look like bird feet.
So would you say that she's able to do this?
She said she thinks she might want to do that.
Good morning. Good morning. Who do we have on the phone? Paul, are you on?
Yeah, you have Paul Brett.
Hi, Paul. And Darian, are you on?
Yes, I'm here. Good morning.
Great. And how about Jody Nelson?
I am. Good morning.
Good morning, Jody. And anyone else who I haven't called out on the phone?
This is Jill Freeman. I should be on for an hour or so.
Okay, so.
Hi. And Marilyn Barley, likewise, for about an hour or so.
Great, Marilyn. Thank you. We're going to go just very quickly around the table. Just give your name and organization since we're starting a little late. I apologize for that. And let me just ask you, I'm Jane Wales, and let me just ask you if you have a BlackBerry to turn it off. Because if you don't, the microphones go mad and provide feedback. So thanks so much. Leona, you want to start?
Sure. My name is Leona Ba, and I've actually referred to this work session by some of the World Bank and ING. And I work as an independent consultant.
Good morning, I'm Shaheen Casanelka with the Conrad Hilton Foundation.
I'm Josh Weisberg, here at Aspen.
Cynthia Sheen-Ottinger, I'm here at the program on philanthropy and social innovation. I'm Clark. Good morning, with the Aspen Institute's Global Housing Development Program.
And ask us to speak into the microphones or the, what matters is the telephone.
Hi, I'm Karen Levan with the Core Group, an association of non-governmental organizations.
You can tell by your talk.
If I could just, for the folks who are on the phone or who are listening in via webcast, if you could turn down your computer volume, it feeds back into the microphones here. Appreciate that.
Yeah, there's quite a lot of feedback.
Yeah, so it might be best to just listen via the conference call and watch online. Maybe turn down that volume. Thank you.
Hi, I'm Ed Boss. I'm the Health Nutrition Population Unit at the World Bank.
My name is Elena Petrova, Program Impact Team of Care USA.
Carol McLaughlin, the Center for High Impact Philanthropy at the University of Pennsylvania.
Hi, this is Kyle Peterson, Managing Director for FSG Social Impact Advisors based in Boston.
Hi, I'm Tom Hayslip with Seven Seas Capital.
Kat Ruscetta with the Center for High Impact Philanthropy at the University of Pennsylvania.
Karen Yanis with Crown Family Philanthropies in Chicago.
Steve Tellis, Johns Hopkins University.
Pat Chai with Aga Khan Foundation.
Elizabeth Alderman with Peter C. Alderman Foundation.
Steve Alderman with Elizabeth Alderman.
Priya Patel, formerly with the United Nations Fund for Population Activities.
Kate Dodson with the United Nations Foundation.
Dan Rosenbaum, Office of Management and Budget.
Folks in the back. Here,
Sandra Oath, also with agriculture.
So I moved from the back, Adelaide, from the IG building.
Thank you for doing that. What we're doing, this is just a very quick word of context. The Aspen Philanthropy Group, which is a group of CEOs, presidents of private foundations, corporate foundations, and community foundations, and one family foundation, come together each year in the summer in Aspen to identify those issues that would benefit from a collaborative look by grant makers and grant seekers alike. And last year, what they asked us to do is take a look at the whole issue of metrics and evaluation, try to gain a greater understanding of what are the optimal approaches and how do you communicate those approaches throughout the philanthropic sector. Everybody in this room deals with metrics and needs to gather data and analysis of that data in order to inform their decision making. And so we thought what we would do is hold a series of meetings with people in different issue domains to see what has been the optimal approach, what best practices can be exported to other issue domains, and what really are approaches that are unique to that issue domain. We thought we would start with an issue area where there's been substantial investment in the whole issue of metrics and evaluation, and that's the global health field. We're going to move on a month from now to a conversation about domestic education with a focus on teacher effectiveness, so you have a sense of the trajectory. So today, and then ultimately we will be reporting out to these foundation executives to talk about what are the optimal approaches to metrics and evaluation. How does that get communicated to a much larger community of grant makers, in particular, leaders of family foundations, but frankly, a wider community of both grant makers and grant seekers. And the idea would be to find opportunities for co-funding that were based on a shared notion of the goals that are one is setting out to achieve, and a shared notion of how to measure success, and they can tell you've reached success, and also to find efficiencies, particularly in both the grant making and grant seeking communities, and to improve the level of communication there. I thought what we would do is start this morning with a conversation about why measure. What are the decisions that need to be informed? And what is the appropriate data? Where do you need data? What kind of data do you need? What decisions do not require that kind of data? And we thought we'd start with a very large foundation in this field, the Gates Foundation, as Jody Nelson is speaking back. And then going to turn to Dan Rosenbaum to talk about from the O&B perspective, the public sector perspective. We may get also, as they talk to us about the World Bank's perspective. And then I'm going to ask anybody from the Family Foundation to let us know the degree to which there's alignment between family foundations and others, and the degree to which there is not, whether or not leverage can be found. So Jody, you get to start us off.
Wow, thank you. Jane, can you please restate the exact question again, just so I stay on topic, since I can't see everybody? I'm afraid I'll ramble if I'm not clear on the exact question.
Well, the large question is why do we measure? What's the reason? And the kinds of things we'd like to answer is this question of who are the primary decision makers? What decisions do they need to make? What kind of data do they need to have in order to make informed decisions? And then finally, whose job is it to collect that data?
Okay. So I'd like to begin by saying that so I am, just to better self-characterize, my name's Jody. I am responsible here at the Foundation for what we call impact planning and improvement for the global development programs. Impact planning and improvement is a team that works on both strategy and measurement. It's a centralized team that is really kind of accountable to the top as opposed to being deployed to the teams. And I say that because I think the structure of measurement within an organization is something you may want to tackle at some point, because it is an interesting point of departure across many organizations. And the second, so that's who I am. I'm currently acting director for the team. Some of you may know our phenomenal director, Faye Twersky, who is just stepping down today. In fact, is my first official day as acting director. And she has done an enormous amount to really define or help define an approach for the foundation, a philosophy for the foundation that we call actionable measurement. I think compared to some of certainly the bilateral or multilateral organizations at the table, the Gates Foundation has a bit of a luxury because we don't have to report to Congress. We don't have to be, at the whim, or not whim, but at the strategy of government or government decision makers or budgets. And so with that in mind, the co-chairs, Bill and Melinda Gates, quite maybe 2 years ago, were very specific about their philosophy of measurement. And they said specifically that they wanted measurement at the foundation to be strategic and actionable. In other words, they wanted the data that we collect or are responsible for collecting to be used to inform our actions and specifically our decisions. And we have helped to flesh that out a little bit as the strategy and measurement team. And I can share with you, or Jane can share with you, the guide to actionable measurement that is now on our website, which is really an internal document that seeks to provide some meat on the bones for what we mean by informing decisions with measurement. So the first disclaimer I would say to answer your question, Jane, is that we're very early days in saying, this is a philosophy we believe in. We don't believe in collecting data for data's sake. We don't believe in, a series of baseline, midterm, and, annual surveys that then sit on the shelves. We are trying really hard to say, what kind of data do we need to make decisions? And how do we design those measurement approaches so that they inform decisions? So I would say, to go to your questions, what purpose does measurement inform? We're kind of looking to the teams. The Gates Foundation is organized by strategies, and that's where the majority of the decision makers sit. And each team's decisions may be different. I think it's very hard to give uniformity and say these are the decisions that Gates Foundation decision makers make across the board. So it's still aspirational, and it varies by team, and certainly by situation. So we have instances where a strategy team may take certain decisions up, whether to invest in a certain vaccine, whether to invest in a certain crop, whether to scale up a certain model or replicate a certain model. Decisions may be at different levels, and that matters enormously, I think, in terms of the purposes. So the primary decision makers differ. The data that they need differs, and I can certainly give examples, but I guess my gut, and based on our kind of philosophy, is that I would caution against oversimplifying. That each purpose and the questions you need to answer given that purpose, and I can give a few examples, require a different kind of data. And kind of saying, M&E broadly defined doesn't really give visibility into what that looks like. So to give a couple examples, and then I'll stop and maybe ask if there are questions. My area of expertise is more development than health, so you'll forgive me if I give development examples. But to give an example, if we invest in strengthening the CGIAR system in agriculture in sub-Saharan Africa, so the international basis for agriculture research that exists in many countries in Africa, and we want to contribute to the reform effort, and our purpose is to inform that reform, and we want to evaluate whether or not our investments to those centers are making it successfully to the national systems in each country. We might choose a particular evaluation design in order to say with some confidence, we believe that doing that investment in a certain way will affect the national agriculture systems in a positive direction. So the purpose of informing the reform is primary. The question of what do we need to learn about the reform process, not about the reform process, but about the investment we make to the CG Center as far as it reaches the national center in a given country. The specific questions we articulate are then very important. And then we say, okay, what's the specific evaluation design, or what are the data available, or what do we need to measure more broadly? So that kind of step of the purpose, the question, and then the measurement approach are integral to actionable measurement. So we don't really say, there are a finite number of purposes, there are a finite number of questions. As all the measurement experts in the room know, there are indeed a finite number of measurement approaches. But what we're trying to do is say, by virtue of what the foundation does, the different kinds of investments it makes, the different kinds of questions we ask, we choose those approaches accordingly.
Let me ask one quick question and then open it up for anybody else who's got questions. Give us for example, Gates Foundation funds a good deal of research. Obviously, they're not measuring what the findings will be. They're supporting discovery. They're open to what the outcome is. So what are you measuring when it comes to research?
That's a great question, Jade. So again, just to put out there, our approach is really new. So when I talk about what we're, I can talk about what we hope to measure given the approach, not necessarily what we're currently measuring. Just to acknowledge this is a really big foundation with a lot of teams and a lot of investments, and we're early days in institutionalizing this approach. But to answer your question specifically, one of the maybe innovative things that we've sought to do with actionable measurement is look across the foundation at the types of investment that we make. So research is a type of investment we make. Product development is another. Model development, demonstration of a model's effectiveness, advocacy. We have kind of common types of investment across the organization that go across U.S. programs, global development, and global health. And so we've looked across and said, where we do research, indeed, we're not looking for the influence that research has on health outcomes, for example. We want to know that, but we're also very reasonable about the process of research and the outputs that are necessary to get to that. So as an investment type in research, we say we're looking at outputs, and we're looking at the process of the research. So if there are certain things that a program officer believes or that a team believes are necessary for successful research, certain variables, certain indicators, or certain processes that you could look into in the lab about management, about timing, about staffing even, that a program officer might want to look at that to know that indeed the process is going well. And that the major results are the outputs that result from that. But acknowledge very clearly that success of the research is certainly a leap of faith, right? That you can't guarantee that the research will produce exactly what you want to.
Do we have any questions from Paul or Darianne or Marilyn? Not good. So we have a question of Jody.
Hi, Jody. This is Kat from the Center for High Impact Philanthropy. Just to extend your example with the research, when you're looking at the process metrics or when the team is, how are there good benchmarks that you're using or that the team is using to understand what is good, what is reasonable? And if so, what are the sources of the benchmarks that you're using?
That's a great question. It's too early for me to say. I think we will learn over time, collaborating with our health colleagues, to see if there are, and they would know better than I do about where those benchmarks would come from.
This is Kate Dodson with the UN Foundation. You mentioned a good point towards the beginning of your remarks about where you structure performance measurement within the foundation, and you said that your team is deliberately structured to be accountable to leadership rather than within the teams. Could you talk a little bit about how that decision was made, what are the pros and cons to orienting the team's focus towards leadership versus embedding within the team structure the strategic decision-making teams?
Absolutely. It's a great topic. So the history of our team is one where we've tried both approaches. And I think, so, and I've also worked in a large organization where I was embedded as a measurement person. So I've had quite a bit of experience on both sides of it. And I really think there are pros and cons to both sides, and it depends largely on what the organization is trying to do. Here, again, kind of given the organizational context, it was very, and I'm being quite candid, it was difficult to have authority to say as a measurement person, and as a fairly small team, but we had people deployed across the different programs, it was difficult for us as professionals to say to a very expert team in agriculture, in malaria, in whatever the sector may be, you know, you should do it this way. Because the decision-making authority resided with the team. And I do think that's an inherent tension with measurement, is kind of this sense of that you might experience from people that really know their business, that are not measurement professionals. So people in the sciences or in agriculture development, for example, or any other sector, that measurement is somehow intuitive. And I think there's kind of an assumption out there that it's common sense, that it's nothing particularly technical, and therefore it's just an opinion of how to do something differently. And given that, it's very hard for a deployed, it was hard for us as individuals, as deployed people, to say, look, we really believe this is the way to do it, enough so that all decision makers and a team would say, yes, we agree. So it was almost too open for interpretation, I would say, and very hard to get to a common approach across the foundation. So the centralization was a movement by the CEO to give the team some independent authority, to give the team an ability, or to give this specific organization an ability to say, actually, there is a best practice to measurement. We do want to have some commonality across the teams and across the organization, and we're going to define those standards, loosely defined, and approaches, and then help the teams meet them and really assess whether or not they do. So in a sense, giving the team a little bit more teeth, which has been challenging. At the beginning, there was quite a lot of pushback, and I think the onus is on us to do a good job by our colleagues and show them that we can really add value and not kind of have, institutionalize a system of punishment, which is not at all what we intend to do.
I'm going to call on Priya now, but just, Jody, it would be helpful if as you answer these questions, you differentiate between the job of measuring the foundation's, the impact of the foundation's strategy, and evaluating a grant. Whose activity is being evaluated?
Do you want to answer that question, Jane?
Sure. I jumped on line. I'm sorry.
So that's essentially one of the big challenges that we have, exactly the question you framed. And I think very different from an implementing organization, which is where my background is. Our strategies are intended to represent more than the sum of the results of individual grants. And if we were just measuring individual grants, I think it's hard to sum that up, almost impossible. But looking at a grant is a little bit easier in the measurement challenges it presents. So where our challenge is certainly unique in my experience, I'm sure that you all as donors face similar challenges, is saying, what is our actual cumulative effect is one way to look at it. We look at it less like that and more about what are we learning, what do we need to make decisions about our larger strategies. So that's one distinction, is at the strategy level, we're trying not to say what's the cumulative impact of our work, acknowledging that exercise is difficult, if not, I would almost say impossible. But so we are in fact talking about how do you make measurement plans that encompass a strategy's work and intentions, and that by being very deliberate in what you want to learn and the decisions you want to make and what data you need to make, you necessarily say, okay, we don't need to collect every bit of data along every indicator of the logic chain of every grant. Instead, we need an overarching plan that says what specific data from what kinds of investments do we need to make decisions. And our hope is that that relieves the burden on grantees by saying, no, we don't need to measure the effectiveness of every single approach. We need to measure the effectiveness of our most strategic investments because we want to do something with them. We want to advocate for their replication or scale them up or something very intentional. And we want to create plans at the strategy level that then situate grant level measurement in a bigger picture. But easier said than done. This is really the challenge we're facing right now.
Hi, this is Priya Patil. I was with the UNFPA until recently, but I wanted to respond to Kate's question, which kind of dovetails on what you were saying, Jody. At the UNFPA, I was in the Division of Oversight, and we took a risk approach and an investment approach to looking at the effectiveness of country programs. And so sometimes there's a dynamic tension between program people and evaluators and measurement people. And so by embedding, by having the Division of Oversight Services respond directly to the Executive Director of the UNFPA, we were much more effective in, one, sharing what we've learned about the country program, investment strategies, figuring out whether they were relevant or not, and then having our recommendations implemented in the country programs. If the evaluations were not, we were an independent division, but within the UNFPA, and having that independence, I think, is critical to really implementing the recommendations that you discover as a result of, doing your data analysis and talking to the country offices. And I've been on both sides of the coin, being independent as well as being embedded within an organization. And I find that depending on the relationship you have with the country program, it's a lot easier to implement new systems and processes when you have kind of the backing of leadership as opposed to just coming in as an evaluator giving suggestions.
Good morning. I'm Lisa Carty from the Global Health Policy Center at the Center for Strategic and International Studies. And Jody, I have a question about the advocacy framework. You mentioned that as one of the 4 core areas that you're looking at for how to better measure impacts. And I think it's very clear that particularly in the Washington environment, the foundation has had a very large impact itself on raising the profile of global health advocacy. So I wonder if you could say a little bit about what you've been learning about the challenges of measuring the impact of advocacy types of activities, how one tries to actually look at the attributable benefit of some of those discrete activities, and how you see the foundation's approach evolving in the future. Thanks.
Great. Again, sorry to be so self-deprecating of our team, but I just want to be clear that I can't represent all that the foundation does. So much of what I'm saying is about our intentions going forward. So I can't speak for the Global Health Policy and Advocacy team. I can speak for what we hope will be the case moving forward in terms of advocacy measurement. And we have certainly dealt with the ins and outs of how difficult it is to measure investments like that. But just to be clear that I'm not trying to represent existing practice. So with that in mind, I would say my common sense would be we're not looking to attribute impact to our advocacy investments. I think it's hard enough to attribute impact to service delivery investments or things where you can in fact observe or aspire to observe some link between what you do and the changes that you hope to seek. With advocacy, I would say, I don't know how many of you have talked to or read Michael Quinn Patton's work, but he came here and gave quite an impressive series of talks on measurement. And the one that hit me the most was on advocacy, and simultaneously we were developing the Guide to Actionable Measurement, and I think that our approach mirrors his significantly, and that is indeed paying attention to the outputs that you produce, because that is said whether or not you did the work you were saying you were going to do, and then clearly identifying the outcomes, the realm of possible outcomes, and trying to measure those where it fits your strategic purposes. So for example, if you are like the global health policy and advocacy team seeks to influence the attitudes and behavior of certain elites, you could, as you know, you could measure their changes in attitudes over time. You could also seek to measure whether or not they personally advocate for changes in budgets or put certain ideas on their agendas with their constituents. So there are certainly ways to look at whether or not their attitudes and behavior changes. But I think the more important part of our approach is to look at advocacy as a fluid investment. In other words, acknowledging that it's a really fluid, political context is fluid, and that you need some way to capture data in a shorter time cycle and bring that data to bear in your decision making about what to do next. And I would say that's something we haven't really done well, and that we're aspiring to kind of figure out how to do that. The advocacy work here is broad. There are different kinds of advocacy investments. So I can't say that we've really gone into that area and then fulfilled the short cycle feedback, the measuring of outcomes. We're doing it little by little, but that's where we're hoping to go.
Okay, what I'd like to do is turn to Dan to just get a sense. I know that OMB has been trying to take an approach that will streamline the evaluation process within government. It'll be interesting to see, give us a quick overview, but also to see the degree to which your goals align with those debates that you're developing.
Yeah, it's interesting hearing this conversation because at OMB we certainly struggle with a lot of these same issues, and in a lot of ways in spades, because we're dealing with so many different agencies, so many different decision makers. Let me take a step back first and introduce myself a little bit, because I have a somewhat colorful background that actually gives me some useful perspective on a lot of stuff. Actually, 3 years ago was, I got a PhD in economics. 3 years ago, I was actually a tenured economics professor. Spent a year at the Council of Economic Advisors, planning to go back, and then this job opening came up at OMB for a career position, so I'm not a political, I'm a career person at OMB. And then decided not to go back to my academic job and stayed here in Washington, D.C. In a role where at OMB I'm in the economic policy division, and we kind of serve as consultants to kind of the rest of OMB, where most of the rest of OMB is situated in branches that are devoted to specific agencies where they focus on specific programs. In addition to all of that, I actually also have a moonlighting job, which actually provides me a lot of insight to a lot of these things too, because I actually consult the Cleveland Cavaliers basketball team, and use statistical analysis to help them figure out who to trade for, who to draft, how to keep LeBron, who should coach us right now, and that experience is combined with the academic experience is very valuable, because a lot of times those decisions are decisions that are going to get made at some specific point in time. Unlike in my academic career, when you are generally looking at decisions that you don't really ever kind of envision anybody's going to look at your paper to make a decision with. And so you get a sense. I'm always in the position of having to think about is the data that I'm producing good enough to actually inform a real decision? And that's a very different question than you sometimes ask as a researcher, as an academic. Now let me talk a little bit about OMB. OMB touches in kind of the data empirical evidence in a lot of different ways. There's lots of active policy decisions where we're actively consuming lots of empirical evidence and doing literature reviews and things like that. But in addition to that, we're also producing and compiling a lot of empirical evidence in at least two major ways. There's one area which I don't deal a lot with, but is the performance measurement areas, where we're kind of regularly trying to measure the high priority performance goals of all of the different agencies throughout the federal government. And I think that's to help inform more regular, it's kind of to give a more regular measurement of data and have more and more decisions both on the management side and on the policy side and budget sides, to have them informed by data. I tend to work more in the area of the evaluation evidence that we produce and use. And I think one way to think about, and one of the things that we did last year that this administration did, we had in October there was a memo that went out from OMB, from the OMB director, that had kind of 3 prongs to it in the evaluation areas. One prong was kind of setting up an evaluation working group that would kind of share best practices across the various different agencies. The second prong was creating an inventory of evaluations that have been that are ongoing or recently completed throughout the federal government, something that's not currently already done. And there's lots of reasons. There's an advantage to that. One of the most obvious is that if agencies do an evaluation and get an answer they don't like, if you don't actually know they're doing the evaluation, they can just not. They can hide that in the circular file cabinet. Whereas this is going, hopefully this additional transparency and accountability is going to result in those things seeing the light of day. And then the third piece I think that got the most attention was we actually had new money that was kind of outside of the regular budget process for new evaluations. That agencies sent us. Now we did this last year on a very quick time schedule. We sent out the memo in October. They had to send things back to us in November, and then we had to make decisions within a few weeks in November. And so there was a question of and then this year we're going to be able to do this in a much more, and I think anything's relaxed, but in a much more relaxed manner than we did last year. And so we had to, when we were doing this, we had to think about there's an almost infinite number of things that you could try to evaluate in the federal government. And what we wanted to do with this process was to, instead of having evaluation activities compete against program activities for dollars as they typically do in a budget process, we wanted them to be competing kind of against other evaluation activities so that we were funding the highest priority evaluation activities throughout the federal government. In this, and maybe we'll be able to find places where we could evaluate things that would cut across various departments and do a lot of the bigger things with this. And so we had to kind of step back then and think about, well, what were we going to ask the agencies to do in putting together these evaluations? And I think a lot of this are I think things we want to have the agencies guide their decisions as they're putting together their evaluation plans, and as they're figuring out how to spend their own budgetary dollars in addition to the ones that are coming through this process. And I think one of the things we started with is we wanted folks to start with the questions first. I think too often there's too much. I did this maybe when I was an academic, where you kind of think in terms of the data or you have this you have this data and you think you have to evaluate this one program, and so you kind of start down that road. We wanted folks to ask, what important questions do you need answers to that will actually inform real policy decisions? If there's some program that's going to get funded at pretty much the full amount, regardless of whatever evidence might come, in some world where we have an infinite amount of resources, we might want to evaluate that program and see whether it works. But in a finite world where we don't have infinite resources, we probably don't want to expend our effort trying to figure out whether that program works. In that kind of case, we probably maybe want to figure out, could you run that program one way versus another way, and try to evaluate that question, because that actually might be something that would be actionable. And I think when we're and in terms of thinking and going down the line, in terms of how we would think about programs, especially the kind of programs that we're dealing with, are in very, very different places. I mean, there's agencies. There was one agency after we awarded them a little bit of money for, evaluation capacity, kind of asked the question, well, what is program evaluation? And so we have some agencies where they have experts that know a lot about evaluation, have a long history of doing very, very good evaluations. Then we have other agencies that don't, and we had to kind of think about, how we deal with that heterogeneity of agencies. And the other thing, in terms of thinking about questions and thinking about what kind of evidence will actually influence decisions, you have some areas where there's already a very substantial body of evidence that's built up. And in those areas, the methods, the study methods that you use, you're going to probably need to have something that's much more rigorous, maybe much larger samples, maybe more, generalizable, in order to actually influence decisions. But there's other areas where there's not a lot of research evidence. Maybe the policymakers don't have a tremendous, they don't have huge opinions one way or the other, where that bar is not quite so high, and you can potentially get away with, if there's a way you can economize with methods, if there's something that's less expensive, maybe using administrative data in a creative way. Those we wanted to try to take those opportunities as well. So we tried to think about when do you actually need the most rigorous evidence, and when do you need when is something else going to potentially still be able to influence decision making. Another thing related to this is we increasingly, not just the program initiative, but a lot of other things we've been trying to do, avoid situations where we're doing evaluations kind of for evaluation's sake and end up in a situation where you might have a very good research method, but maybe have way too small of a sample. And so you almost know what the answer is going to be before it goes out in the field. You're going to get statistically insignificant results, which may not be as terrible in the foundation world as it is in our world. In our world, it's a disaster because the consumers of that information are not sophisticated to realize the answer was we wasted our money doing this evaluation. But they're going to interpret a whole bunch of statistically insignificant results the program failed. And then you're obviously inferring something that wasn't actually true from the data that you collected. And second of all, you make it that much harder to do evaluation in the future because programs are, they have a good reason to be skeptical of us doing evaluation if we put them in situations where we have an underpowered evaluation that's almost surely going to result in them getting statistically significant results. And I think we've been careful to try to think about it's not just sample size that obviously matters there. In a lot of circumstances, you may have treatments and control groups in various, regardless of what kind of method you're using, that the control group or kind of gets some sort of other treatment that may share a lot of the same characteristics as the treatment group, and so the difference between your two interventions are not that big. And in those kind of situations, you need to be bigger sample size than you might have anticipated. We've been really trying to be careful to think about those kinds of circumstances. And the other thing that I think that Jody talked about a little bit, and we've been struggling with a lot as well, is it only does you so much good to produce all of this good empirical evidence that folks don't use it at the end of the day. And so that's why I think we've been really trying to focus this on the important policy questions that folks would actually use it for. But I think we've really tried to focus a lot also on agencies and trying to empower evaluation offices or other places within agencies to actually communicate this empirical evidence to the right people and have this be and we have a lot of decision makers that we really need to influence. It's not just the folks in the agencies, not the folks in the executive office of the president. Ultimately, Congress is the one that's has the purse strings on all of these programs and all of the evaluation dollars, and so they're as important as anyone, and then a lot of the folks that they listen to as well are really kind of important decision makers in all of this. So we're trying to be creative to think about how to about that is, we don't have the luxury of just having Bill and Melinda Gates as being, the two people that, ultimately, might have a really, really large influence on decision. There's just so many decision makers, that we ultimately have to, kind of convince. And I think that's, another thing that we, try to think about in terms of the evidence that we try to produce as well. I mean, I can talk about this topic forever, so I'll stop at that point.
So Jody was talking at the level of strategy,
right,
and you're talking at the level of program. This is a very naive question, but in the federal government, are there circumstances in which you would be evaluating competing strategies, competing set of solutions to the same problem, or are you always evaluating the existing solution?
One, and that's what I think I touched on. I think sometimes that's the more interesting political. The question that can actually inform some real decision is actually comparing one strategy versus another. One way of running the program versus another way of running the program. And so so I think in a lot of cases we're evaluating strategies, not whole programs. There are circumstances where evaluating whole programs is the important policy question, but that's not always the case, and probably not even typically the case in a lot of situations.
Wait, can I interrupt for 1 second? Sorry, it's so hard when I can't see if this is the proper etiquette. But Jane, if it's okay just to respond to that, I wonder about the use of the word strategy. I mean, here, the word strategy is the entire portfolio of investments for a given sector. So if you're talking about malaria, you're talking about, the full budget of malaria investments and the ends, in this case, eradication, right, that strategy, that portfolio of investments is seeking to accomplish. And I wonder, Dan, with your use of the word strategy, if you're talking about, approaches to solving a given problem at an intervention, or, for example, do we use subsidies, or do we use conditional cash transfers, like a given strategy to solve a problem?
Yeah, I think, I'm thinking of it in the more narrow intervention strategy, sense than in the, big picture sense. Although obviously, in some sense, the evidence that you would, generate from looking at, a lot of these, these interventions, or, would accumulate to be, something that would inform the larger strategy, policy decisions. So I think, so I think there's an interconnection here.
So Kyle, and then
Hi, this is Kyle Peterson, FSG. I appreciate how you're sort of talking about this transition from accountability to learning, and really that's where you want to go, that's where you struggle.
Mm-hmm.
I think everybody in this room struggles with that, but I think that is the big shift, certainly as we see it in terms of evaluation. I guess when you were mentioning the various constituents for learning, you didn't mention this community, sort of the greater social science community, the greater social impact community.
Right.
And I'm wondering, discussions maybe linked to the Office of Social Innovation, are there thoughts about getting that information out, which is just so priceless, to folks in this room?
Yes, that was kind of an oversight on my part not to, mention. Part of the reason why I'm here is, that very purpose. And I think, yes, there are, I was thinking of it in the narrow sense of the folks that we need to influence to, maybe get the, I'm very focused on OMB sets out a budget and trying to get that budget passed and influencing those folks. But yes, there's a whole other set of consumers, which, the foundations are one of those big groups that would benefit from, from the evidence that, that we're producing. And so I think that's part of the reason why I wanted to be kind of part of this, was to kind of, share and think a little bit more together about some of those issues.
Peggy and then Carol.
Thank you. I appreciated that both of the speakers referred to the notion of informed practice as being sort of the holy grail and what we were really going towards. And it's this question of to-be abuse, and to what extent, in this sort of section, why evaluate at all? It seems to me the heart of the matter is precisely but I do need to say it's very much of a black box. We don't see a lot of evaluations of dates that we do them ourselves on our grants. We don't, so I would like to pose to the group in this sort of step back framing question, why evaluate? That we are not trying hard enough to really work together on sharing the learnings of what works and what doesn't work. Because we're losing the battle. There's never been more money going into rural health. And we have moved some needles, but many, many other complex needles require us to have really interesting learning communities around how this works women this way, this kind of rural outreach. There's the complexities are endless. And to me, there is a ready community that can be invested in more around this question. So I guess I would ask the two speakers to respond to that and others to respond to that.
So Jody, the degree to which the goal is to inform the field more broadly.
I think certainly it is to inform the field more broadly, but not always and not without purpose. So I think, part of the challenge is this kind of, all data are good data for all purposes. And I think it's like it certainly is a public good, but it still needs to be very intentional. Again, I'm talking aspirationally instead of what's this now. So I think now there is a movement in the foundation directly from the top, from the CEO, Jeff Rakes, to be dramatically more transparent with the work that the foundation does and the data it creates or is, in part responsible for. So I do anticipate that you will see in the next year more evaluations, more things that we are partaking in terms of social science research or impact evaluations and the like. You will probably see more of that available because that's the trend here. But I think the notion of sharing with the field and for practitioners still needs some deliberate intent to it. Or else, how do you as a practitioner know which evaluation is most useful and what the purpose is? And I'm not sure if that makes sense, but I still think it needs to be strategic and purpose-driven, even though it's toward the obviously good end of sharing.
You've answered this question.
Well, and I think the other thing, I think we've tried to increasingly get some of the final decision makers invested in, in our case, certainly invested in all the performance measurement metrics that that are being developed for them, but then also invested in some of the evaluations that get done. Because in particular, a lot of this is driven by policy officials who are a lot of times not going to be around 2, 3, 4, 5 years from now when a lot of the evaluation evidence may come to fruition. Having a lot of the program office folks invested, in this, and really wanting to see what the results are, and maybe even folks in Congress invested in it, in a lot of times is really important for us.
I think that the question of...
Can I say something on the phone? Can you hear me?
Yes, Paul.
Hi, this is Paul. I want to challenge a little bit the suggestion that the dissemination of evaluation information metrics needs to be strategic. I mean, it's true on the one hand, you don't want to just put out any junk, and you certainly want it to be high quality. But part of the wonderful thing about the dissemination of knowledge is you don't really know exactly how it's going to be used by others. And I would much rather have foundations and other people who are collecting any sort of solid, reliable metrics on a subject to make them available and to leave it, to them or other intermediaries to suggest how they can be used and how valuable they are, than to think ahead of time of what the particular uses that they might be put to are. I'll stop with that.
Thank you.
Great point.
One thing related to that we're increasingly trying to do is when when agencies do evaluations and outside contractors collect data, we're increasingly trying to make those data sets that that the evaluators put together publicly available for folks. So I think for this very purpose, and I think there's a lot of push to try to make administrative data more accessible for outside researchers for the same reason as well, so that there's a lot of questions that we may not ask that others may want to ask that I think it'd be valuable for us to have the answers to.
Carol and sorry, you're looking forward. Go ahead, Carol.
Carol McLaughlin from the Center for High Impact Philanthropy. I was also interested to hear people's perspective on thinking about another decision maker, which is the actual implementer or the practitioner in the field, and if when people are thinking about evaluation strategies, particularly in the performance evaluation of how much are grantees brought into the process, about how useful the data will be to them, and then if so, are donors investing in the capacity of the grantees to actually collect and use that data in a real-time manner.
Paul, you might want to help in the answer to that. What is the relationship with the grantee? How is this information shared with the grantee so that it is a truly a learning process and of course corrections can occur, et cetera?
Yeah, I think I'm not sure I have anything particular to contribute, so I'll just sit that out.
And Jody, weren't you talking primarily about an internal foundation audience?
So, no, I wasn't. Our work is more on the planning side, but the evaluations at the grant level here are often done by the grantee or within the grantee's budget. So, by nature, they are geared toward the grantee or at least intended to be by the grantee, used by them. One thing I've noticed, though, is a real expectation on the grantee side that the foundation expects kind of evaluation of impact. And by that, I think grantees interpret that very widely. But what I've seen that to mean is, for example, in any kind of agriculture project, whether it be on the upstream in research or on the downstream working with farmer organizations, the grantees seem to say, we of course will measure our contribution to changes in household income. And I think the burden's on us to make clear that that's not necessarily the case across the board. It puts a lot of burden on the grantees to collect that data, which is usually a household survey, and may, in many instances, not provide the grantee with data they can use to make decisions about implementation. So I do think there's something amiss in our communication so far about what kind of data we expect grantees to collect and why, and not just what will we do with it, but that we don't necessarily expect them to want something they don't need for their own implementation.
But when the Gates Foundation evaluates a strategy and interacts with a grantee evaluating a grant, how does one communicate to the grantee what the larger strategy is and how their activity fits in?
That's a great question, Jane. That's something that came up in our grantee perception report about how unclear the foundation is about its strategies and that grantees are uncertain about how they fit into it. So we don't do a good job at that so far. We have data to show that. There is a lot of movement to correct that. So in the case of an evaluation, let's say, a strategic evaluation would be one that informs strategy, would be one where you're really testing a certain assumption or saying, we believe, let's say in the water sanitation strategy, we believe that a certain approach to community-driven sanitation and changing behavior is really something we want to invest in. And we're doing that across 4 countries, and we're doing a pretty rigorous impact evaluation in 2 countries because we're saying we believe this approach is something we want to advocate in the future if it works to governments to take it up. So there's an example of, with that particular sector, in that particular strategy, the specific grantee, which is a part of the World Bank, knows and is doing impact evaluation with us, and they know that that approach that they are implementing on the ground is a big part of our strategy. So that's a good example of where it is clear to the grantee. But there are lots of other cases where that may not be the case.
I had one other thing to add to that, actually. Shelley Metzenbach heads up our burden on them to collect a bunch of data for them. She's kind of a belief that we should send the data back to them in a way that there's value added so that they can actually use it to implement their programs. So I think that's something that we're increasingly trying to do when we ask, grantees or other folks that for data.
Hi everyone, I'm Hillary Chen. I'm here from the Office of Science and Technology Policy. A couple of comments based on a recent experience, which is that we've been working on a mobile health service domestically that then will have applicability globally. But we've been in this process of thinking about evaluation, and it brings me back to a point that Dan made early on, which is the importance of figuring out a way to make sure that we have these evaluations at a time when decisions can be made about them. And I think, and the point was made over here as well, but I think it's a challenge, and maybe part of the way we think about that is actually to think about different sectors and what the what the possibilities are for timelines within different sectors. I mean, I know in government we've been going through this process, and the absolute shortest that they can give me on an evaluation is 3 years, and I don't really want to push on that because I think the evaluation is quite robust and it's important to understand it thoroughly. At the same time, most of us will be gone in 3 years. The decisions about the program will have already been made, and I think I have often found myself wishing for whether it is whether it's coming from private sector or elsewhere, if there were people who are able to do evaluations more quickly or who already have resources stood up in that area. So aside from kind of this specific experience, I do think it's important for us to think about what our capacities are respectively, and in the U.S. government, recognizing that we have an ability to, I think, do things at a scale that's tremendous, but at the same time, we're not able to move very quickly in evaluating those things, and so that's really important. The other thing, I'm glad, Dan, you came back to this data issue, which is that there's been a tremendous push for, as part of the Open Government Initiative, to make more data available, and I think that's something that I know that the World Bank has also recently released a large amount of its data, and that's useful, I think, both for researchers in thinking about evaluation, but I think also moving the ability to evaluate in a very visceral way directly to end users, directly to consumers, and people on the ground who are able to access that information. So, we have sort of the option for very large-scale evaluations done by government or others, but then also, I hope, a medium track in which people can be a little bit faster in evaluations, and then also making the data more available so that consumers who otherwise might not have been able previously to have access to what's going on program-wise will now have the ability to do that.
Thanks, Hillary. Further, David, and then Lisa.
I just wanted to mention a couple of challenges that we often face that haven't been mentioned, and then a process that we've attempted to use, which I think is
For those who are on the phone, David from Save the Children.
Right. Which has worked, I think, to some extent anyway, yet to be fully proven. But first of all, the challenge is the whole issue of reaching a consensus on what in fact are appropriate metrics. That may sound simple, but it's not, and we struggle with it all the time. So I don't know if we'll get to that issue and how we deal with it, but it needs to be a challenge. The second is that almost everything we do, and I would guess that many of us do, we do in partnership, and that includes the U.S. government all the time. And having spent a career in the U.S. government before joining Save the Children, we are always being challenged to, in effect, justify, if you will, investments that the U.S. government has made. This was in the area of global health, in terms of outcomes or impact. And it was always a challenge because we were one of many players what difference would it make if we answered them? Because they're important. There are gaps in our knowledge, and if you answered that question, it really wouldn't make that much difference. So what difference would it make if we actually asked and answered that question? And then for us anyway, are we in a position to actually ask and answer that question? Because typically what we do, we have to do a partnership, and we have limited capacity within our own organization. So are we really in a position to ask and answer the question? Or how do we engage key stakeholders? Because if you don't do that, our experience is that the likelihood that what the evidence you generate may in fact not be used or will have less influence than it would have otherwise. And so right from the outset, engaging key stakeholders both in defining the problem, the potential solution, and then actually tracking our progress and trying to in fact answer those important questions is really critical in the countries where we work. And then lastly, something that I think we also struggle with but is really critical is that it doesn't end there. So asking and answering the questions, disseminating the results is one thing, but we want to see evidence that there's actually been a change in policy and practice. And so taking that next step of actually monitoring, measuring the extent to which that new evidence has actually been put into practice to us is really important.
Karen. Oh, Karen Van from the Court Group. I just want to build a little bit then on what David was saying, that monitoring is as important as impact evaluation. And I think a lot of times as grantees, we're asked to report on outputs rather than looking for the outcome of what we're trying to do. And so grantees get caught up in trying to fulfill donors' expectations rather than using a process of formative research that can inform design and learning that will ultimately help you get to an outcome. So you miss the whole learning part in your quest to fill out generally a lot of quantitative outputs. And I think that cycle of breaking that kind of cycle and having people report on data, having data and data use become part and parcel of all of their activities definitely can help generate more of a kind of a learning environment. And then that gets into a cost issue that I think many of us always worry about. We're asked to report on what's the cost per beneficiary of delivering certain services. If you want to do that, you generally then have to give up your quest in order to become a learning community, because doing the formative research, doing certain metrics like or methodologies, quality assurance sampling, where you're engaging stakeholders in defining what's wrong in one area, local area versus another, it puts, instead of having then local stakeholders take responsibility for their own learning, you're putting the learning at a higher and higher level, which really impedes, I think, the flow of the field. So I think costing is definitely a major issue, as is strategies that will push for the program learning up and down the chain.
Just one observation. I think somebody earlier mentioned making sure that the organizations on the ground have the capacity to conduct some of the activities necessary for these evaluation efforts. And I just want to make a distinction between two types of capacity that a lot of organizations don't have. One is simply they don't have the time, the people, or the skill to collect the data. But the other is, and I'm sort of riffing off of what Dan said, even if you sent that data back to them, having never used or seen that data, they don't have the time, skill, capacity to interpret that in a way that could actually help them beyond helping fulfill some sort of requirement they had in reporting. And so both of those capacities, if built, would extend the impact of all of our M&E activities.
Just to, actually, that was one of the points that I wanted to make. And, I think the experience this group, should look at is the experience maybe of the Global Fund, which I think now has between $6 and $7 million in investments, has been underway for 5 or 6 years, has an M&E framework, that a lot has been learned from, that I think has been quite transparent. And actually, I think one of the big learnings is exactly what you said, which is, we're talking about global health, which means it has to happen over there as opposed to here. And one of the fund's constraints has been the real capacity to have people at the country level who can do exactly what you described, who can collect, interpret, analyze the data, and then use it to make programs better. But I think there's a lot that this group could look at about how that approach has evolved that might be more broadly, applicable. The second issue I just comment on is, I guess in this discussion, it's not tension, but I've heard a little bit of it's either accountability or learning that are the objectives of sort of this monitoring and evaluation exercise. And we've talked a lot about the learning piece, but in my experience, the accountability piece is really critical as well. I mean, for all the reasons that Dan described. If you're not accountable to the Congress and you don't turn that information into something that's easily understood by people who don't have a lot of time to sit down and try to understand it, you can have the best data set in the world, but it's not going to translate into meaningful information for people. And I think we need to think more about who the ultimate consumers are and what the ultimate decisions are that they need to be making. So it's a very complicated picture because you have so many different layers of people you need to have these different systems served. But I think it's really important to map that out actually with some clarity. So.
Yeah. Steve Tellis, Johns Hopkins. I just want to ask two maybe skeptical questions. One is about the opportunity cost of evaluation, right? That is, any organization, it basically has to do the thing it's doing, right? Whatever that is, right? And evaluation, in some cases, may be totally integral and natural to how that organization operates, but it may also, in some other cases, where in very different kind of cultural environments, may require a huge change in an organization that, to some degree, would be at the expense of the core activity it's doing. So I think one thing I want to get on the table is how we actually think about the opportunity cost of evaluation, and when is that opportunity cost significantly large that we would want to say that it simply wouldn't be worth doing or imposing in the form that especially funders may want. The other thing is, and mainly because I'm a political scientist, so I think about these things, that I think about the activity of advocacy evaluation as so fundamentally different than the activity of either program evaluation for services or anything else, that we may just want to think about them as being entirely different, not sharing anything in similarity, or at least being so different that we might want to simply have a completely different conversation. So I would be interested in whether people think there is actually enough similar between advocacy and either program or other kind of evaluation that we'd want to think about those tools being the same, or whether we should try and simply segment them off into completely separate conversations.
Hi, this is Paul from the phone. Can I do it right?
Yep.
First of all, on Steve's second point, I completely agree. I think advocacy evaluation it's just different enough, even if it's in the same general domain, that we should treat it separately. On the first, and let's leave aside the distribution of the cost, the allocation of costs between funders and organizations. I think the fundamental way that we look at evaluation is it is a cost. And that if you model philanthropy on an expected return basis, that is that every cost ought to be justified by having a benefit that is greater, then you have to think of evaluation in that way. And that's also a good discipline for deciding what to evaluate and what costs. Now, there's a trick here, because to the extent that it's producing broad knowledge for the field, you're back in the very difficult position that some people mentioned earlier about how do you evaluate research and knowledge. But as difficult as that is, I think that the mental discipline is to think of evaluation as a cost that ultimately has to be justified by a greater benefit. Thanks.
Thanks, Paul. Matt.
Yes, I was going to just add on to the earlier comments about the consumer end of
looking at evaluation results. And I think, this is something that we've really grappled with. And sorry. So particularly in global health, where a lot of what we're trying to achieve is behavior change of consumers of health, I think there really has to be more of an interactive loop looking down at the ground level of how we engage. I think this is what David was getting at, with the people who are actually accessing services or who we're trying to encourage to change behaviors. And how can they be involved, both at the community level, but local practitioners, local decision makers who are trying to figure out what to do with resources at, say, a district level. How can they be involved in that process with us and have better access to some of the learning, but also inform some of the learning that we're trying to pull out of these programs?
My name is Leona, and I'm currently an independent consultant, but I'll speak from my experience working in planning and evaluation with the International Development Research Center. And they've done a lot of work with participatory evaluation. And I must say that whenever we've used that approach, it's made a dramatic difference in use. Just having stakeholders speak about their own needs and their own uses for information. And one assumption that we often make as researchers is that we think that what is knowledge for us is knowledge for everyone. What is knowledge for us might just be data or just information or just a blob of information. So just going from the starting point of the user, the end user, and trying to think of what might be knowledge for them. A lot of you brought up the issue of capacity. I worked a lot in sub-Saharan Africa, and a lot of the reports that are sent don't make any sense to them. It's full of abbreviations, it's full of jargon, and it's just in the form of books. These are people who are more applied, and it just sits there and collects dust. So a lot of my work was trying to I worked a lot in extensions, so trying to translate that into very simple ways that people could actually use. So just kind of filling that gap between the results that we get, which are very good, and actually getting them in the format that people can use them. And that's something that I think we do very well.
Jane, it's Jody. Can I speak to that?
Yes, and then we're going to turn to Ed and Hillary, and then we're going to move to the next section.
I can also wait in line.
Let's move to Ed very quickly then, because I want to get into this point of view of a multilateral organization.
Yeah, thanks, Jane. The bank is very different from both Gates and U.S. government in that our operations are really the country's operations. Those projects are lending or loans or credits that are owned by the countries. And as a result, we generally want to rely much more on the country systems to do the monitoring. Now, in health, the basic data systems data collection systems are often much weaker than in other sectors. And a bit ironic that you pick health first as a topic, subject. The sort of basic vital registration that reports on number of deaths are missing in most countries. So trying to align as much as possible with the countries is a real obstacle for better M&E. And my sort of sense is that the weakness comes from this lack of measurement, much more so than the absence of indicators. We have indicators in every subsector of health, volumes with reproductive health indicators, with nutrition indicators. We have plenty of metrics to measure health by, but the measurement itself is not carried out. So one area that we have tried to scale up in is in strengthening the measurement in countries, but it's a big area, and Global Fund, of course, is trying to do it as well. And more donors are realizing that in order to sustain measurement, it's not through the occasional demographic and health survey that a donor might support, but it's the routine data systems in the countries that will make the difference. I should also say that I think it's important that we measure not only the outcomes or the intermediate outcomes, but the entire results chain of that is part of the operation. Quite often, we try to look for improved coverage with the health intervention when the resources have not even reached the districts. So looking at inputs and intermediate outcomes and then look at the impacts, I think it's essential. And quite often we are interested in the outcomes and we forget about looking whether the money was actually available in the districts. Of course, there are many different types of M&E, and I see two colleagues from the bank's independent evaluation group that tend to look more at other aspects. My own area is strengthening contributing to the M&E in bank health projects, so it's a slightly different emphasis than what IEG does. We also have a group that looks at impact evaluation of different delivery strategies, such as conditional cash transfers, but that's a much more narrow focus than the overall M&E in bank projects. So that's what I wanted to say. Thanks.
Great, thanks so much. Hillary, and then Jody.
Thank you. Just a very quick point to draw folks' attention to this question of tools. I think that particularly as technology evolves, that there's a tremendous opportunity to think about new tools that will facilitate evaluation across the board, not only here in the U.S. but also globally. So, I think about some of the data visualization tools that are being developed that I think, will help address some of the questions around, translating what do professional evaluators think about data and how do they interact with data versus how do people who are just coming into the field or may not be as familiar with it. I think we've seen this domestically as people think about the open government efforts and thinking about different applications. So we have the different apps competitions going on right now, which is just really about trying to create new tools for people to interact with data in new ways and make it more accessible to a much broader population. The other thing, every organization I think I've ever worked for or seen has some sort of system for trying to identify best practices and share those best practices or connect people. Right now we're looking at Expert Labs project. I know that USAID has a number of knowledge management practices as well, but I think this is an area where as technology evolves, that there's new opportunities to connect some of these communities of practice within and among the different organizations. So I think this tools question is actually a really interesting one, not to take us to the next level in terms of implementing the goals that we're talking about.
Okay, I think, David, you get the last word in this segment.
All right, thank you. I just wanted to clarify one point on indicators, that it's actually not an issue, certainly, of a shortage of indicators. I think as Ed was pointing out, we have, at least on my show, reams of indicators. It's really reaching a consensus around what are the critical metrics that we ought to and should be using to monitor and measure progress and performance. And the second is to just reiterate a point that Ed made, that we often go directly to measuring coverage and impact without knowing anything about
one of your sense of whether there's some convergence across sectors around what we're referring to as a decision-based approach. So, and so therefore I'm going to ask Josh very quickly to take us from where we, give a snapshot of where we stand right now, but Liz, make your intervention one back.
Okay.
Liz Alderman.
Can I just, I was going to say one point on the previous conversation, but it's relevant to the next one. If there's time for just one comment.
Yep. So Liz and then Jody.
I'm sitting here listening with great admiration for the many things that you have been discussing. We are a small operating foundation. So much of what you are talking does not apply to small operating foundations. And yet, we desperately need the data to make sure that our interventions are effective. And this is something that we are working on. We have people who are collecting data on the ground, and it's also very important for us that we not sit and come up with the data while we're sitting in New York, but in the countries where we work, because when you're there on the ground, the questions that you may be thinking up in New York don't necessarily apply. And so we really haven't addressed that in this part of the small operating foundation, working on the ground, trying to collect data that is meaningful and instructive to guide us in terms of moving forward.
And this is in the area of the focus of this foundation is on mental health.
Which is very hard to measure. Thank you, Jane.
Thanks, Jody.
Hi, this is Paul. Before you turn to the next thing, I just want to apologize. This has been really terrific, and I've got to go. So I'll learn more from Jane what happened. Thanks.
Okay, thanks, Paul. Jody, you want to give us the final word?
Yeah, I just wanted to underscore, it's a little bit of the last point as well as the point on participatory evaluation, and underscore that point that was raised. And for me, it suggests a really another important point, which is decision-based or action-based measurement differs depending on who the decision maker is, which I think is self-evident. But the point about participatory evaluation underscores how implementers or local organizations or whoever it is actually doing the work on the ground, they usually face a much different landscape than we do, sitting remotely, and in the case of Gates Foundation, very remotely, 6 degrees of separation from the ground. And so I think even if we move toward decision-based measurement, action-based measurement, we still haven't resolved that fundamental issue.
Great, thank you. I'm going to turn to Josh, and then Elaine, you might want to comment. So, Josh.
Yeah, just very quickly, this is probably too much information for one slide, but the intent of this is to kind of paint a picture of where global health spending writ large on that first bullet point, and then from that, where money has been spent to try to evaluate. And what you'll see is a lot of this data is pulled from the Institute for Health Metrics and Evaluation, which is has been funded in large part by the Gates Foundation and is at the University of Washington. And a lot of the spending has been in the area of has been at that kind of meta level that we were able to find and break down. And it's interesting to hear Liz Alderman's comments about, and some other comments about which stakeholders have access to this data and are able to kind of make decisions. How far down the chain does this data flow? And it's clear that quite a bit of money has been spent there at that top, kind of in the expert domain. But it isn't clear how much of this is pushing decision makers, and at what levels is it used. And I'd be interested to get Elaine's perspective on how stakeholders interact with this. I know she's had some experiences working with the bank, and how many different evaluations can be conducted, and to varying degrees of usefulness. So it'd be useful to hear about that. And then perhaps how you talk about whether FSG in its research on decision-based evaluation, whether you have found or been able to figure out how much money has been spent in that area with that strategy in mind. And it sounds like more is now that the Gates Foundation is taking that approach. So this is a kind of a high-level overview of where things have been. And that last bullet point is simply to acknowledge that gold standard that that many grantees and others think about when they think about evaluation. How should I do evaluation well? It is that randomized controlled trial, and that is in people's minds many times the aspirational goal, whether or not it is appropriate for their activity and for the decision makers that they seek to inform. But that has been refined through countless drug trials and in the private sector, and has kind of become what it is, whether that is the right strategy or not. So that's a high-level overview for us.
Hi. Actually, I was talking to Josh, and I mentioned that I just come back from a lesson extraction exercise in Cambodia, and the main reason why we went out there is to basically draw lessons for the global community in health and global partnership programs. The Global Fund and the World Bank had an interest specifically to look at how they were interacting on the ground and to what extent that it was also in alignment with many of the guiding principles which found the basis of the Global Fund's coming into being. As Ed was saying, increasingly with the Accra Accords and the Paris Declaration, we're very much, there's a move definitely to go into using the country systems and not overburdening the country. So there are these talks about harmonization of donors, measures, interventions, as well as collecting information, monitoring, and evaluation. So now, and at the same time, a very important principle of the Paris Declaration is alignment. Alignment basically means you have to be aligned with the country's development strategy and the country's development goals, and in alignment with the country's capacity and what have you. Otherwise, you're coming in with expectations and you design your programs and whatever measures you have, which are not consistent or not in line with the country's capacity and own needs. So in the case of Cambodia, I'll just give you a little bit of a snapshot. Cambodia is a very small country, 14 million people, thereabouts, but there are 42 donors, development partners. And when I say 42, I mean basically the multilaterals, the bilaterals, big foundations, and then there are 900 NGOs. This 900 actually was, I guess, 2007, and that includes both international NGOs as well as local NGOs that basically was set up by international NGOs. So you can imagine for a small country like that, which has perhaps roughly 80% of its development budget coming from outside, you can imagine the burden on this little tiny country, and what is its capacity to do any of these things, both for feedback as far as how money has been spent by these various donors, not only the large development agencies, but the little, not so little NGOs. For instance, Save the Children is operating there, whatever, examples of this. So one of the findings, both in interviews as well as reading other evaluation reports recently, I'll comment on the Global Fund, for instance. Global Fund, which recognizes the need for capacity building and monitoring and evaluation, and understanding that the country has so little capacity in this area. So the Global Fund provides, let me just say that I'm just using the Global Fund as an example since we're talking about the Global Fund, because this is pretty much the strategy that most donors adopt anyway. So the Global Fund has provided grants or money to develop capacity within a grantee or within the government or within the NGOs that it supports. So essentially, when you go down to the ground, you might find there is quite substantial resources for the country, whether it be the NGO or the government, whoever is implementing the measures. Okay? At the national level, you might find there's capacity to hire 2-3 M&E experts, right? That's at the national level. And their salaries are highly subsidized, obviously. Take note that the average monthly pay of a civil servant in Cambodia is $45 a month, right? Which is, of course, which is actually lower than what you call subsistence. So at the national level, you could have 2-3 M&E experts. Then you go down to the provincial level, you will have the grant will also pay for one monitoring and evaluation expert, also subsidized. Then you go down to the district level, and then you may have maybe half monitoring and evaluation expert, not so well subsidized, and then you go down to the facility or community or lower than that, and there you find one person whose core work program is not monitoring and evaluation, but that person ends up doing all the data collection. That person is not subsidized. So it speaks to those issues where we're talking about you're changing really the core of whoever it is to support the monitoring and evaluation. So if you go deep down enough, I mean, we have all these great ideas and intentions, good objectives to strengthen data collection and knowledge. And I think Cambodia is a great example where you have 80% of your development budget coming from outside. You have so many donors for such a small country. And then you look at, you overwhelm their capacity to do anything, really, in this area. The government actually has stated in the Cambodia Aid Effectiveness Report where it talks about, yes, we do want to learn from whatever we can, and we value and appreciate these interventions from the global community in supporting our capacity development. But this is really taking us away from our core objective, and this is actually counterproductive. And just in terms of monitoring the Paris Declaration or evaluating the Paris Declaration, because that's actually underway. The Paris Declaration on harmonization and alignment is actually being done, the evaluation of the Paris Declaration. So Cambodia was one of the countries as well for this evaluation. And actually in the government's development effectiveness report, it said we participated in this because we wanted to learn and we wanted to contribute to the global knowledge. However, just the exercise of participating in this is really taking away our core. It's distracting us. So I'm just summarizing, but everything is actually, the evaluation reports are out there. If you just pull out, you can see the country's perspective. And Cambodia happened to be one of the few countries, rare countries, where such a small country, which is so aid dependent, can actually speak out and say, please, we value what you're doing, but just be aware of what's happening on the ground, and what you're actually doing is actually counterproductive. So I'm just for the first part of this morning, we're basically talking about where is the money going. We have to have accountability to people who are actually providing the money, and we have to learn lessons, and then we have to address both accountability issues as well as programmatic learning, performance issues. These are all great, and they are great ideals. But bear in mind, for most of these cases, we still rely at the country level, at the district. I mean, somebody is collecting this information because you're actually not going out there to collect it. So whoever you are supporting, you're requiring them to provide you with this information, right? So just bear in mind this is what is happening. And then with this Paris Declaration, where they talk about let's get together, let's harmonize, so the donors are actually not having or cutting down on the number of indicators that they're collecting. And in the case of Cambodia, they've actually come up with what they call joint monitoring indicators. So it's agreed with the donors as well as the country what are the priority, top priority, 1 or 2 indicators in health that they want to look at. I've not followed this very closely myself, but I know 2 of the indicators they're looking at. One is in HIV/AIDS, and then the other is in maternal health or reproductive health. One in terms of so it's a reproductive health, maternal health indicator. So that has cut down on the workload quite a bit, because then you have these joint missions where the donors and whoever they participate in, they go out and actually take a look at that, and they agree this is our priority indicator. But there's so much going on at a country level, it's a very difficult balance to undertake, because on the one hand you have to find out, are your dollars going both to effective programs? You want to find out whether you want to change your strategy or your tactic for that particular development measure that you're undertaking. And at the same time, you say you want your stakeholders at the country level to learn from whatever they're doing. But the whole exercise, the whole process, it becomes sometimes so much is invested into the process of collecting information and so on and so forth, that the end result can be very counterproductive and very burdensome.
So this is back to Steve's earlier point about the opportunity cost of Paul's responsible cost benefit analysis. So let's take Steve, Tom, and then Kyle for now, because we will have to break for lunch.
Yeah, one thing that I think also gets raised in this, especially if you're working in a country like Cambodia, but I think it's actually general to evaluation, which is when people talk about evaluation, they often use that as synonymous with data, right? Because they're thinking about evaluation is about measuring the outcomes, right? But in many cases, the really big problem in evaluation is assessing what the treatment is, right? That is, especially if it's a project that's out in the field that is where there's an enormous cultural difference, where it's hard to even figure out what someone's doing, right? You might say that whatever they were doing was effective, right? And they might have told you they were doing some program that you had described to them, right? But that doesn't always mean that in the field that's what people were doing, and in some cases that's what you want. You want people to make adaptations to whatever they've got at hand, but that also means that being able to draw a clear line between what somebody was doing and whether that's effective, so then you can tell somebody else to do it. I think that also means, therefore, that any evaluation has to inevitably have what I would consider to be a sort of ethnographic component, right? Where you actually had somebody, they are figuring out what they were actually doing, rather than just having somebody, in the back coming at the end and saying, oh, and then, they reduced HIV by whatever it is, right? You don't actually know what they were actually doing that was leading to that result.
Thank you. I've been sitting here sort of patiently trying to figure out where the logical answers to some of these questions are, and I frankly am at risk of just contributing my own confusion to the conversation. So apologies in advance for what I'm about to say. Specifically, the lens through which I'm engaged in this conversation is really at 2 levels. One is through vulnerable children in Africa, so looking at the care and need of 20 million odd children in Africa and what they need to become fully functional, productive citizens. The other lens is constructing investment strategies that can align people to put capital at risk in African healthcare. So healthcare runs sort of deep into what I'm thinking about. 2 points I think I wanted to share. One is, speaking about vulnerable children first, after all the millions first and then tens of millions and now even billions of dollars that have gone to serve the needs of orphaned and vulnerable children, 90% of the care is provided by family groups, kin groups in Africa, which is to say that the real heavy lifting is still going on in those kinship groups, in those communities. And I think what's important, this builds on Pat's point about the consumer, not just the grantee, but who's the beneficiary of this whole conversation. And the point I wanted to make here is that as we talk about monitoring and evaluation strategies, it absolutely must include that local community, because if it doesn't, it becomes so irrelevant. And worse than that is that the local community response begins to look up to, where's that money coming from? Oh, that's what I need to be focusing on. When in fact the sustainability of the intervention rests squarely on the shoulders of the leadership in those communities themselves. So I just wanted to underline that point. The second point, coming from the investment logic, is, it's always hard when you try to create systems to create alignment. How do you keep somebody whose goal is to make money aligned to a mother who wants her child to find a cure for the malaria, the parasite that's running through the child's body? Somehow, some way, this whole process can't get too caught up in the science. It really, I believe, needs to sit very squarely on the essence, the sort of the spiritual piece of this whole conversation, which is, how do we do good? How do we do good on a sustainable way? And yes, maybe when we've started to do that repeatedly, we can begin to look at cost effectiveness and other measures. But I worry that we're dancing up here with the angels on the tip of the pin, and we're not, right here where we need to be. So again, apologies for adding my own confusion to the conversation.
Sir. So I guess the question was, how much is being spent on all of this? And I wish I knew the answer. We've only begun to scratch at this, and I would say that this is, I don't know where this is going for the future, but I would sort of say, item number 1 or 2 on the research agenda. We started to look at this, and obviously everything you have up there makes a lot of sense, but there's so much going on. Gavi is probably doing 10 to 15 evaluations a year. The Global Fund, the bilaterals, our government, DFID, the Dutch, all of them are doing evaluations. And this adds up to tens, if not hundreds of millions of dollars that are being spent a year. So your point, Steve, I think is an important one. I think that the amount of money that's being devoted is important, probably more interesting. The last time I looked at the OECD guidelines on evaluations, could be an outdated observation, really, I think, de-emphasized the issue of learning. There was much more about accountability. Obviously, that's important, but I don't think it's caught up with the times. And that guideline process affects many of the donors who are then funding implementers, and in some cases then even influences many foundations and how they think about how to conduct evaluations. The other 2 other observations. One, we did a very small sort of look. It wasn't even a research practice, but just to look to see among maybe 15 evaluations that were conducted by some of the big bilaterals, 5 years later, 3 years later, were the recommendations in the evaluations, were they followed? And it was mixed. It was really a mixed bag, which is a concern. Now, there are always reasons for that to be true, why someone would not change practice due to a recommendation. But I think this comes back to sort of the central tenet of why we're here. I think we want to get the information. We want to do all this effort to actually change practice for the better. And I don't think that's always what actually follows from evaluation. One last point, and that is, as you look at some of the large evaluations that are done by bilaterals, you see much more emphasis, much more real estate dedicated to the past, to the look back. What has happened, which is important. Less, as we've seen, about what are the implications going forward. What does this mean for the strategy? And again, I think that has to do with just perhaps, I wouldn't say outdated, but you can see that I think evaluations conducted by a lot of the big players need to be nudged, I think, a bit into what we're talking about today.
With all this money being spent on metrics, I found it very odd that we still have a lot of unintended outcomes. So people measure what they want to measure. The Global Fund for 8 years measured HIV, TB, and malaria. It took 8 rounds before they started to think about health system strengthening and what this excessive amount of money focused on 3 diseases was doing for the maternal and child health agenda. PEPFAR came in and focused on outputs around HIV, and yet of the areas because of various breastfeeding and water sanitation issues. So having these systems, we need to be able to use these kinds of impact evaluations or to have some, I think it's brought up, some very key telltale indicators on the health of a system that need to be mandatory, I think, in a lot of the work that's being done. So we have a better understanding of that we're off track. We might be on track for certain things, but we're really off track with a bigger sustainable health picture. And just one example, a small one from the U.S. government Child Survival Health Grants Program, all grantees have to measure a standardized set of indicators. It's up to 18 now, whether or not they intervene in that area or not. One of them, for an example, is immunization coverage. We know as a public health good, that is a telltale sign of is your health system functioning or not. It doesn't take that much extra work to collect that indicator, but that way it lets you know that, I'm not doing this work, that's probably one that could save the most lives. Maybe I better reroute my project efforts or do advocacy or do something in order to solve some of these bigger issues that we don't need to wait for a gavel or, there's some way to relay information to the system, to the government, so that adjustments can be made.
That's sort of what I'm trying to get to when I asked about evaluating the program as the approach to solving a problem as opposed to a problem that's not looking at multiple approaches. And it gets particularly interesting as you get more siloed and more focused. Is that it's very easy to lose the larger objective to challenge oneself, to look at the environment as a whole. Disease-specific approaches are a prime example. One example of Lisa, and then Steve, and then I'm going to forecast where we go.
So just two very quick points. I was just going back to the primary purpose of the discussion today, which is to help philanthropists make use of current M&E frameworks. And when I sort of step back and think about what I've heard in the conversation this morning and what that kind of really means, it seems to me that, and I worked briefly for 5 years at the Gates Foundation, so I had the perspective of a philanthropist at one point in time that, if you're sitting there trying to make decisions about how to use your limited resources, you need to know what works best in the area where your core mandate is. And that's kind of the nexus that you have to find. And this has become, I think, a really complicated, enormously interesting, but it's a discussion that really illustrates how complex this problem is. And I don't know if there's a way to start to disaggregate some of this by what some of the constituents in this room find is important and find is lacking, so that you sort of hone in on exactly what it is that the discussion can bring forth. Because I think it's a very important discussion. I don't think there's been a lot of clarity around it. The second point, and it's just something I've observed in the last couple of weeks, actually it's the results of some analysis done by the Institute for Health Metrics and Evaluation, came out in the last month with two big studies that look back over, I think, the last 10 or 15 years at maternal mortality and child mortality outcomes. And they actually found that the outcomes have been better than what UNICEF and WHO and some of the other global health entities have been putting forth. Now, you would think that would be good news. In fact, it appears to set up this huge furor in the global health community with, op-eds in the Lancet and all kinds of toing and froing because, I'm not an epidemiologist, but people seem to have a funny attitude about data. You kind of own it and it's yours, and then, and in fact, it probably belongs to the countries, and as a number of people have said, we really need to be focusing on helping those people who are the primary partners in the implementing environment use it better, and I just think collectively there needs to be a bit of an attitudinal shift in how we're really collectively trying to make the data and the systems that use and produce the data work better. It doesn't appear to me that's necessarily the mentality right now. So,
well, we train and we make policy at the district level. I have to agree with Steve, is that where it's really happening is at the community level. And to understand how to propagate an effect, you really need the non-formal health people in the community. And that usually is patients, their family, and very good tool. That is, with it, you participate. People are nodding. That's good. No, you participate with the groups at ground level and observe them at the same time. And while you're doing this, you can shift your aim. So you're allowed to have a data flow that's on a large basis that you can use to make decisions. RCT, randomized controlled trials, are wonderful. They take time, they're expensive, and they're too narrow. You have to define a very narrow question. You can't ask the big questions. And so I think that this is a little bit more efficacious for dealing with it.
So what I'm going to do is call a halt to the morning just because I can hear stomach grumbling. And then when we come back, Kat, I may turn to you to talk about some of the hurdles of the stand in the way of a decision-based approach. And then I want to move back to the notion that there's more than one sector around this table. Sorry? Anyway, so that's what we're headed. What we're going to